Hello. In this video, we will talk about Escherichia coli, its microbiological characteristics, and its clinical significance. Escherichia coli is the first bacterium isolated in medical pathology. It is a common host in the human intestine and is responsible for spontaneous urinary tract infections and gastroenteritis. It tends to develop resistance to antibiotics in both community and hospital settings. In terms of habitat, Escherichia coli is a bacterium found in the commensal flora of the human intestine, where it acts as a normal symbiont of the digestive tract. It accounts for approximately 80% of the aerobic bacterial flora, while 99% of intestinal bacteria are strictly anaerobic. In terms of bacteriological characteristics, Escherichia coli is a gram-negative bacillus, often motile due to Peritrichus flagella, with a capsule that varies depending on the strain. In terms of pathogenicity, Escherichia coli presents a wide variety of clinical pictures. Some strains remain simple commensals, while others are undeniable pathogens, mainly responsible for urinary tract infections, whether community-acquired or nosocomial. One of the main pathogenic effects of Escherichia coli is urinary tract infections, especially in young women, whose short urethra facilitates ascending fecal contamination. Lower urinary tract infections manifest as acute cystitis, while upper tract infections are represented by acute pyelonephritis. Uropathogenic strains possess specific virulence factors that explain their pathogenicity. In addition, this bacterium can cause septicemia, accounting for 45% of gram-negative bacilli septicemia and approximately 20% of all septicemia cases. It can also cause meningitis, mainly in newborns. With regard to intestinal infections, specific strains of Escherichia coli are pathogenic and cause diarrhea. There are four main pathovars: enteropathogenic E. coli, enteroinvasive E. coli, enterotoxigenic E. coli, and enterohemorrhagic E. coli, each responsible for specific clinical forms and virulence mechanisms. Enteropathogenic E. coli are responsible for epidemic diarrhea, especially in pediatric settings in developing countries, particularly where hygiene is poor. Their pathogenicity is based on virulence factors carried by a plasmid, including adhesion molecules that enable attachment to epithelial cells in the small intestine. These bacteria adhere to enterocytes without invading them. Enteroinvasive Escherichia coli harbors plasmid-encoded virulence factors, including a Shigella-like cytotoxin, which makes it similar to Shigella. It invades the epithelial cells of the colon, multiplies there, and causes significant inflammatory reactions with ulcerations, leading to a dysenteric syndrome characterized by bloody diarrhea and abdominal pain. Enterotoxigenic Escherichia coli is the most common cause of watery diarrhea in children in hot regions with poor hygiene and of traveler's diarrhea in adults. Its virulence factors include CFA pylori, which enable adhesion to small intestine cells without invasion, resulting in mainly secretory diarrhea. Enterotoxigenic Escherichia coli causes watery diarrhea by producing toxins that disrupt intestinal absorption, the thermolabile LT toxin and the thermostable ST toxin. It also has CFA pylori that ensure adhesion to small intestine cells without invasion. Enterohemorrhagic Escherichia coli, especially serotype O157H7, causes hemorrhagic diarrhea through the massive production of SLT1 virotoxin. This toxin can lead to serious complications, including hemolytic uremic syndrome. Escherichia coli may also be involved in hepatobiliary and digestive infections, genital infections, and surgical wound infections. The diagnosis of Escherichia coli is based on its detection and isolation, which can be performed in any laboratory. Systematic antibiotic susceptibility testing helps in determining the appropriate treatment. Thank you for your attention. We remain at your disposal for any further information or questions.